Welcome back, everyone. Ready to dive into a new topic? Today we're taking a deep look at parasites and how they impact public health.
Sounds intriguing.
It is. We got some cool stuff to look at today.
Oh, yeah. What sources do we have lined up?
We've got excerpts from an article called Parasitology and Public Health.
Okay.
It's from Elevate Dynamic. And then we have a YouTube video. It's called What is Public Health? From a channel called Let's Learn Public Health.
All right, so we're covering both like the parasite side of things and the public health perspective.
Exactly. We're going to try to bring those two together and see what we can learn. And get this. Did you know that some parasites actually need multiple hosts before they can infect us?
Multiple hosts? Like what, they hop around from one to the next?
Yeah, like they might need to spend some time in, say, a snail before they can even get to a human. Wild, right?
That is pretty wild. Talk about a complicated life cycle.
It really is. It makes you wonder how they even figured that out evolutionarily.
It's fascinating. It's like this whole hidden world operating right under our noses.
Right. Okay, so the Elevate Dynamic article starts off by defining a parasite.
Okay, how do they put it?
It says it's an organism that lives in or on another organism, the host.
Right, the host.
And the parasite, it gets its nutrients at the host's expense. Basically, it's a freeloader. Sometimes causes problems.
Yeah, sometimes those freeloaders can be a real pain. And they come in all shapes and sizes too, right?
Totally. They're not all these big, scary worms we might imagine.
Yeah, some are way too small to even see, right?
Yeah, right. Like protozoa. Those are single-celled organisms. Microscopic.
So tiny. It's crazy to think something so small could cause such big problems.
I know. And even the way they live on or in us can vary.
Oh, that's right. There are those different terms.
Yeah, so endoparasites, like tapeworms, those live inside the body.
Okay, inside. It makes
Often in the intestines.
Gotcha.
But then ectoparasites, like ticks, fleas,
Right.
those are the ones that live on the surface.
On the outside?
Yep. There's even a term for when parasites are in your blood.
Seriously. What is it, like blood parasites or something?
Parasitemia.
Parasitemia. Wow, never heard that one before.
Me neither. Actually, that leads right into how these parasites spread.
Oh, good point.
The Elevate Dynamic article goes through different routes of transmission.
And I bet there are a lot, right? They seem to find all sorts of ways to get around.
Oh, absolutely. Some of them, we accidentally ingest their eggs.
Ugh, like through contaminated food or water?
Exactly. Others hitch a ride on insects.
Insects, like mosquitoes.
Yep. Mosquitoes, ticks. Think of them as tiny vehicles delivering parasites right to us.
That's both clever and terrifying.
I know. It's like a microscopic taxi service, but with a much less pleasant destination. And get this, some parasites can even spread through direct contact.
Direct contact. You mean like skin to skin?
Yep. Or even sexual activity.
Wow, they really have all the bases covered. It's amazing how they've adapted to spread so effectively.
It really is. And even before birth.
What you mean?
Yeah, a parasite can pass from a pregnant woman to her unborn child.
That's wild. It really highlights the intricate relationship between parasites and their hosts.
Totally. They've figured out how to exploit vulnerabilities at every stage of life, it seems. And I'm remembering a specific example from the article that blew my mind a little bit.
Oh, what was it?
They mentioned certain flukes that actually use snails as hosts.
Snails! That's so bizarre. What do they do in the snail?
It's like a pit stop on their journey. They actually need to spend some time in the snail before they can infect a human.
Wow, so it's not just a random thing. The snail is an essential part of their life cycle.
Exactly. It's wild.
It's like a multi-stage journey for these parasites. Makes you wonder what other complex interactions are happening out there.
Seriously, it's like this whole hidden world operating right under our noses.
Right. And it really highlights how important it is to understand those life cycles. If we want to control these parasites, we need to know how they operate.
Absolutely. You know, it's almost creepy. It makes me think, what if we are the intermediate host for some parasite we don't even know about yet?
Whoa, now that is a thought. A little unsettling.
It is. But before we get too carried away with those mysteries, I think we should take a closer look at some of the most common parasitic infections that humans face.
Sounds good. Where do we start?
The Elevate Dynamic article breaks them down into two main categories.
Okay.
Protozoa and helminths.
Protozoa, those are the microscopic ones, right?
Right, the single-celled organisms. They're responsible for some pretty well-known diseases.
Like what? Malaria?
Malaria, giardiasis, toxoplasmosis, amoebiasis.
Wow, yeah, those are some big ones,
Hmm.
especially in areas with limited access to clean water.
Right. Public health is a huge factor there.
Absolutely. What about the helminths? Those are a different category.
Yep, those are the worms.
Oh, right, the worms. Okay.
Tapeworms, roundworms, hookworms, whipworms, flukes, all sorts.
And those can live in our intestines, right?
Yeah, often in the intestines, but they can also get into other organs.
Causing all sorts of problems, I imagine.
Exactly. The article specifically mentions tapeworms and how you can get them from eating undercooked meat.
Oh, yeah, that's right. I almost forgotten about that. Makes that medium rare steak a little less appealing, huh?
It does. It makes me wonder, doesn't freezing meat also kill parasites?
That's a good question. I think it depends
On what?
on the type of parasite and how long the meat's been frozen. Some are much tougher than others.
So even with our modern food safety standards, there's still a risk.
I think there's always some risk, especially with these organisms that have evolved such incredible survival mechanisms. That's why understanding how they work is so important for prevention.
It all comes back to knowledge.
Yeah,
Right.
absolutely. Knowledge is power.
All right, so we've talked about the different types of parasites, how they spread, but what about how we even know if we've been infected?
Ah, yeah, the symptoms.
Seems like the symptoms can vary a lot, which makes it hard to figure out what's going on.
Right. It's not always as obvious as some other illnesses.
Exactly.
Yeah.
So how do doctors even diagnose parasitic infections? I'm guessing it takes some detective work.
It can. The article mentions that they often need to do lab tests.
Lab tests, like what?
Things like stool analysis, blood tests, even tests to detect parasite DNA.
Wow. So it really does take a combination of clinical skills and technology to get to the bottom of these infections.
For sure. And it also highlights how important it is to have access to quality healthcare.
Oh, good point. Access to healthcare can make a huge difference in whether these infections are caught early and treated effectively.
Absolutely. It's a key part of public health.
Okay, so before we dive deeper into the public health side of things, I'm curious about prevention.
Prevention, right.
We can't always control exposure to parasites, but what steps can we take to reduce our risk?
Well, luckily, the Elevate Dynamic article gives us some good tips.
Okay, let's hear them. What's our best line of defense against these tiny invaders?
Well, it all starts with, the basics, good hygiene, washing our hands a lot, especially before touching food. That can make a big difference.
It's amazing how such a simple habit can have such a big impact.
Right. And it's not just about hand washing. Cooking food properly, especially meat, is crucial.
Makes sense. Heat is a pretty effective way to eliminate those parasites.
Exactly.
So that medium rare steak is definitely off the menu, but at least I know a well-cooked meal can help.
Absolutely. And it's not just about meat either. Washing fruits and vegetables, especially if you're eating them raw, is important too.
It's like we're building a defensive shield around ourselves with all these good habits. What else can we do?
Well, safe drinking water is another big one. If you're not sure about the quality of your water, stick to bottled or treated water.
Good reminder, especially when traveling.
Right. And don't forget about those insects.
Oh yeah, the pesky insects that carry parasites.
Yep. Using insect repellents, wearing long clothes.
Avoiding those bites, basically.
Right. And there are things we can do around our homes too, like getting rid of standing water where mosquitoes like to breed.
It's a multi-layered approach, protecting ourselves and our environment.
Exactly. And if we zoom out a bit, we can see how all of this ties into public health.
That's a perfect transition, actually, because that's what our second source, the Let's Learn Public Health video, is all about.
Perfect. So what does this video have to say about public health?
Well, first of all, it defines health in a way that you might not expect.
Oh, how so?
It says health is a state of complete physical, mental, and social well-being.
So it goes beyond just the absence of disease.
Right. It's about a much broader sense of well-being.
That's interesting. So how does public health fit into all of this?
Well, if public health is about promoting this overall well-being, how is that different from what doctors do in a clinical setting?
Good question. I mean, both are focused on health, right?
Right, but they approach it from different angles. The video actually uses a really great example.
An example. Okay.
Imagine someone's been in a car accident and they've fractured their leg.
Ouch. Yeah.
The clinician, their focus is on treating that injury.
Makes sense. They're the expert in fixing bones.
Right. But the public health approach is different. They would look at why the accident happened in the first place.
Oh, I see. So it's more about prevention.
Exactly. Were there road safety issues? Was it driver behavior? Were there social factors involved?
So they're looking at the bigger picture.
Exactly. The goal is to prevent future accidents. not just treat the injuries from past ones.
That makes a lot of sense.
And this same approach applies to parasitic infections too.
Oh, I see. So public health initiatives are all about creating a healthier environment to prevent these infections from happening in the first place.
Exactly. And that brings us to the whole concept of the social determinants of health, which we'll dive into after a quick break. Stay tuned.
It's interesting you mention creating a healthier environment, because that's at the heart of public health.
Yes.
And that ties directly into what the video calls the social determinants of health.
Right, we touched on that before the break. Can you remind us what those are again?
Basically, it means recognizing that health isn't just about individual choices. It's about the conditions in which people are born, grow, live, work, and age,